Air pollution levels in Canada and the U.S. have decreased significantly over the past few years. Why should we continue paying attention to our air pollution levels? Is there a point where we can stop focusing on air quality?
Well, it's fantastic that the air quality is getting better. There's no question that it's made a nice contribution in the U.S. and in Canada to improved health as well. So it turns out that over the last few decades, we've learned that air pollution contributes to ill health, but we've also learned that improvements in our air quality contribute to better health. And what's remarkable is that even in areas that have cleaned up quite a bit, that are now only moderately polluted, as we reduce the pollution, we continue to see improvements in health. There is some debate over how low can we go, you know, but so far it looks like even in areas that are already relatively clean, continued improvements still have substantial benefits, especially to human health.
Why should we continue paying attention to our air pollution levels? Is there a point where we can stop focusing on air quality?
Well, I think what's been interesting is that we have not been able to show that there is a safe level of air pollution, that even in what we consider clean communities, when we've been able to reduce air pollution levels, we've been able to see improvements in health in terms of reduced life or increased life expectancy, or reduced hospital admissions and so forth. I mean, there really doesn't seem to be a optimal or safe level, and you know, whatever we can do to keep pushing down the air quality levels are going to lead to improved health.
Why should we continue paying attention to our air pollution levels? Is there a point where we can stop focusing on air quality?
Well, it does look like the health effects of air pollution are quite substantial even at our reduced levels. So we've been, in the early days of air pollution research, we were looking for some easy to manage large scale sources, and we're pretty successful in reducing those. But as we looked through what we thought were the continuing effects of air pollution, it appeared that what was left in terms of the effects of air pollution that we have, say, of today, exceed what we've reduced over time. So we've been successful. I've been at the WHO meetings quite often, and they're always semi-congratulatory about how low our levels are. But nonetheless, our understanding is that we still face quite a large population health impact of air pollution.